Well, let's go ahead and get started. Um, my name's Eliza Zarka. I am the Director of State Engagement for the National Recovery Friendly Workplace Institute, which is an initiative of the nonprofit GRI, Global Recovery Initiatives Foundation. We are so excited to have you here and to host Fors Marsh to share what they've been doing. They had committed to 5 years of pro bono research about recovery in the workplace. And as you may have seen in my email, their first survey was on attitudes of employees with people in recovery in the workplace. And so this is kind of the next step of what does HR really know about recovery in the workplace? So I'm super excited to introduce Matt Escobar, who is a board member of Global Recovery Initiatives Foundation, and he will take it away from here.
Thank you, Eliza. And I'm Matt Escobar. I lead the corporate responsibility division at Fors Marsh. I'm also privileged to serve on the board of directors of GRI. And I just want to take a moment to thank everyone, to thank all of you for your work, the work that you're doing to advance recovery in the workplace. The presentation you're about to hear will soon be released publicly, and we hope it will continue to drive enthusiasm and commitment toward building a better workplace culture, improving education, strengthening hiring and retention practices, and expanding benefits so that all employers of all sizes can play a role in making the U.S. a recovery-ready nation. Kathy Hartnett asked me as a board member to briefly share that the GRI board remains confident that this work will continue to be part of the new administration's drug control agenda as we await appointment of the new head of ONDCP, the Office of National Drug Control Strategy at the White House, and we are actively engaging them in efforts to advance certification. With that, I want to turn it over to my colleague, Claire Turney, our research lead for the survey, who will share the key findings and insights from the study. Claire, over to you.
Thanks, Matt. I'm delighted to see everyone on the call today, and I'm very excited to share this research. As Matt said, I'm a senior researcher at Fors Marsh. I was involved with last year's recovery-friendly workplace survey, and so I found it particularly rewarding to continue working on this year's. First, I'm going to give a little bit of context for what we found, and then I'd like to spend the bulk of our time talking about what our findings mean for next steps in recovery-friendly workplaces. So as Matt said, we found in our first year that employees want recovery-friendly workplaces. When we surveyed people, we found relatively low levels of stigma against individuals in recovery. And we found that people believed that benefits should be provided. Sometimes they were unsure about what those benefits were and if they had them, but they thought they should be there. We also know from a wide variety of research, including work that some of you all have done, that recovery-friendly workplaces provide lots of benefits across organizations. However, when we think about, okay, who's actually doing this work? Who is actually driving RFWs in the workplace? A lot of times it involves human resources professionals. In smaller businesses that might not have HR professionals, the responsibility for recovery-friendly workplaces gets lumped into that set of tasks. So we wanted to learn, okay, what do human resources professionals say they need? What are they eager to learn? What's getting in their way? How can we facilitate recovery-friendly workplaces for them? And the sort of top-line finding, what we'll explore in more detail, is that professionals need information about SUD and recovery. They need time to engage this issue. They need peer support, and they need institutional buy-in. I'm going to talk a little bit about how we know that, which some of you are already familiar with this data, and then we'll go in a little more depth about other things that may help us make a stronger argument for RFWs. I do want to take a moment too to acknowledge that we went straight to the source of human resource professionals, HRCI. If you want to connect with HR folks, that's where you go. They are the leading certifier of HR professionals in the States. And we really appreciate them giving us access to the folks who work with them. So together we fielded the first ever study of HR practices related to recovery in the workplace, and that's what we're sharing with you today. Here's what I'm going to talk about. First, again, we'll briefly touch on what we know about benefits. I'll tell you a little bit about who we heard from in our research, what we learned about how familiar people were with SUD and what training they had, as well as how familiar they were with recovery and RFWs. We'll talk about what policies people have. We'll talk about the barriers, about what gets in the way, and then what people need. So again, as many of you know, there are benefits to recovery-friendly workplaces. We know they lead to improved work culture and better employee well-being, and that in turn tends to reduce absenteeism and turnover. It also leads to improved productivity. When we have a recovery-friendly workplace that openly encourages folks who are in recovery to apply, we have access to an expanded workforce. And finally, there is plenty of healthcare cost savings associated not only with treatment for SUD, but also with sustaining recovery. As you can imagine, it is far less expensive to support a person in recovery than it is to pay for them to go through treatment again. Now, we know, of course, that treatment sometimes happens several times in a person's recovery. I don't want to say that this is a magic wand, but when the Department of Labor, when the National Safety Council talks about cost benefits of RFWs, usually we're talking about that cost of folks who do need to return to treatment. So I just want to say this is information that's out there. And now I'm going to tell you about what people told us. This is the new information, the fresh stuff. We conducted a dual study in the sense of we used both a survey and we also used focus groups. And I'll talk about each of those in turn. We had 1,536 completed valid responses, to our survey, which means people that completed it. We conducted that survey in the last half of, well, more like the middle half of August. And our range of respondents was very impressive. Because this survey was something that people opted into, we heard from people who are already passionate about RFWs, right? So it was really encouraging to see people engaging with this issue across so many different industries. We had HR professionals who were brand new to the field, all the way through people who had, 9 or more years in the field, up to folks who had 20 years in the field. We also had people from organizations of all different sizes, from 10 folks all the way up to 5,000 folks. And we had respondents from every industry. Okay? So when we look at ways that people tend to dice up workplaces to count folks, we had people from manufacturing, from the healthcare sector, education, contracting, forestry, right? We had a lot of different people. And that's important because we recognize that there are different rules and regulations. There are different demands placed on workers in these different settings. So I just wanted to give you an idea of how broad our respondents were. As I said, we also did focus groups. Now, last year, our first year of the survey, we just did the survey itself. And this year, because we really wanted to hear from HR folks in their own words, right? We did some focus groups as well. We had six in-depth interviews with experts in the RFW field. These are people who are running RFWs in their own organizations. We ran 7 focus groups, and altogether we had 42 qualitative participants. And the folks, again, in these interviews and focus groups were HR professionals, and then RFW SMEs working in the recovery space. So here is what we learned. We found that when we talk to people about their readiness for a recovery-friendly workplace, we looked at how much knowledge people have. And on a scale of 1 to 5, we asked people to rate their familiarity with SUD. We had a 3 on average. Slightly fewer people felt familiar with SUD treatment, down to 2.7. And then we dropped down to 2.2 in terms of familiarity with recovery-friendly workplaces. Now, that's not surprising because this is still a relatively new concept, but that high level of familiarity with SUD, relatively speaking, suggests that we have a channel for people to build their knowledge, right, both on SUD and RFWs. These numbers are not surprising when we consider the fact that only 11% of our respondents had received specialized SUD training, right? They weren't getting particular targeted information. I think it's helpful to bear this in mind because often when I talk to folks who are interested in RFWs, who are working on them, it's easy to forget, it's easy for me to forget too, where other people are, right? We're all at different points in this journey. And so it's kind of good to remind ourselves, right, this is where a broad majority of folks might be, and this is where we have room for growth. I want to stop for a minute too, to just acknowledge something quickly. All of us are operating in resource-constrained environments. So you all have graciously given up part of your time today to learn about this information. And at the same time, you know, what this information suggests is that we need to have time to do more training. We maybe need to pay for SUD training. And again, we're all in resource-constrained environments. It may be hard to make this argument. However, because we know a little bit more about what actually is needed, we'll be able to explore ways to use our resources efficiently. And again, I'm going to talk about that more as we go forward. So we talked about what people know. And we're going to talk about, excuse me, that was the wrong slide. Okay, please take just a moment and focus on that graph up there at the top when we asked people about their policies and practices supporting employees who had SUD. Again, these numbers might not surprise you. 74% reported that they had an employee assistance program. 43% had sick leave and PTO for SUD treatment. 20% had flexible work arrangements. 13% had a SUD-specific policy related to treatment and recovery. And then 3% had SUD and recovery training for HR or for all employees. When we think about policies and practices, right? When we think about workplaces or organizations of different sizes, some of these things are actually not going to work for them. So for instance, if you are a bedside nurse, right? You need to be at the bedside. You can't work remotely. Your schedule might not be flexible. So even as we're saying, okay, these are the policies and practices people have that could potentially support someone in recovery, we also know these are not possible for everyone. And that gets me to my next point here, which is the fact that over 80% of US workplaces have a drug-free workplace policy. So that's important because we heard in our focus groups and also in some of our open-ended questions on surveys that people had concerns about whether or not an RFW would contradict that drug-free workplace policy. Drug-free workplaces, you know, maintaining one is a condition of getting government contracts. it's a condition of licensure, ensuring that your workforce is not using drugs through things like urine testing. That's an important part of insurance requirements sometime. So when you start talking with people about, we need a recovery-friendly workplace, some folks think, well, that sounds a lot like it's going to contradict our drug-free workplace policy. And we'll talk some more about that in just a minute. But that's a real barrier, right? That idea in people's heads. And it's a barrier in terms of, again, those constraints that folks are working within: business size, nature of the work they're doing, possible legal requirements. So all of that considered, right? This drug-free workplace policy, and then the policies that people have in place, like EAP, we asked people to assess how supportive their organization was of people with SUD or in recovery. And only 19% said they were supportive or very supportive. About 23% who said they were somewhat supportive. But the biggest group of responses here was that 38% who said their organization was neutral. Now, what we learned in last year's survey is that employees want communication. They want to know their benefits. They want support. But if your employer is neutral, if you're not explicitly saying, this is the support available to you, employees might not feel supported, right? They might not feel that they have the ability to seek help, whether it is in treatment or in pursuing recovery. So that's an important number to bear in mind, right? To consider what the level of perceived organizational support is. So we've talked about what was happening at organizations so far, like in terms of policies, leadership support. And then we asked about barriers to recovery-friendly workplaces. 64% said their biggest barrier was a lack of knowledge about SUD and recovery. And following close on its heels is the misconception and stigma problem. People not only don't know about SUD and recovery, they might have the wrong idea. And the next two are related. 42% said they had concerns about the cost to implement these policies. And then 35% reported insufficient staffing to support these additional programs. Lastly, 34% reported insufficient training for HR and managers. So at a high level, we have a lack of knowledge or a misunderstanding across employees. Right? And then as we drill down, we get to the fact that there's insufficient training for HR and managers in particular. I want to talk about the managers for a second. Okay. What we found in year one of the survey was that when people needed help, when they needed support in their recovery, when they needed to think about entering treatment, the first person they usually talked to was their manager. They often did not go to HR first. They started with their manager. So when we think about who we're training, giving managers the tools to respond effectively to their employees is important. Now, I know we looked at that, graph just now about overall support for recovery-friendly workplaces within the organization. But if we looked at leadership support, our biggest number is I am unsure. So kind of like the neutral folks, people who said, that big group said my organization's neutral. We've got another big group saying, I'm unsure, I don't know. So HR professionals are reporting these barriers, and they're also reporting uncertainty around what leadership thinks. It's important to know organizational views on SUD, but it's also important if you want to change those views, and we know this, of course, from studying the workforce. If you want to change those views, that has to start with leadership. Going back again to our first year study, we found that leaders often thought that they had a fairly robust SUD policy. They were interested in helping employees, but the employees didn't know that, right? They didn't perceive that willingness to engage on SUD and recovery. And so even if leadership supports RFWs, they need to share that. And when people are unsure about leadership support, it's not very helpful because they may feel uncomfortable acting either to implement and drive recovery-friendly workplace policies or to seek help. So I do have some good news here. It's coming. We asked people very concretely. We found out all of these things about them, and then we said, tell us what you need. If there is nothing else that you walk away from this presentation with today, this is the information I want you to have. It's 7 things that HR professionals need. Again, we have a resource-constrained environment. We may not be able to do everything. But these are the things that HR professionals, the people who will be on the front lines of implementing and driving an RFW, this is what they need. First, they need case studies of other organizations that have RFWs. They do need a proof of return on investment. You know, a leader wants to see the bottom line, but that only goes so far, right? It's not always possible to put a dollars and cents figure on some of those benefits from an RFW. So having case studies from other organizations that can say, listen, these are the benefits we saw, that's really helpful. They also need peer support in the form of connections to other RFWs that are making things work, who are having challenges and need to discuss them. And that also is an opportunity to share best practices. So again, those case studies plus direct conversations with other RFWs. They need time and space to do this work. We are all being asked to do more with less. We're living in a time of transition when employees might have a lot of challenges, where organizations might have a lot of challenges. And it might seem problematic, right? It might seem sort of out of touch to say HR professionals need time and space. But as you'll see in just a minute, there are ways that we can work it in. There are ways that we can help people get bite-sized chunks of knowledge. And so in particular, HR professionals note that they want modular trainings, off-the-shelf trainings, a 5-minute video that they can watch, a handout that they can share with their managers, ideas about when to communicate about substance use disorder and recovery. One of the really simple suggestions that would be an example of that, like quick action, would be when you talk about paid time off in your organization, an example you could use is, hey, we can help you use your sick leave or your PTO for treatment or to support your recovery. In addition to these off-the-shelf trainings, these things that are easy to access, people also wanted scalable trainings. We know that the needs of a small organization, 10 people, 12 people, are going to be very different from people in a really big organization. So we need trainings that can work at all levels. People also need connections to resources that are already out there, and I'll talk about those in just a minute, that make sense for their particular organization. So some discussions about RFWs tend to get to a point where, you know, we might say, oh, there's this online toolkit. And there will be a lot of tools, but it can be difficult to have an idea about what's actually going to work for your organization. So people need specific ideas about what to use. And lastly, And I know I said this before, I'm going to say it again, we need leadership buy-in. And what that means is not only leadership that supports policies, that support RFWs, but leadership explicitly saying having a recovery-friendly workplace and supporting our employees in recovery is important to us. We don't want to leave that message up to chance. We don't want folks to not know the stance of their employer on recovery. We want them to know. We want them to hear it over and over again. And that voice not only of HR, so those are the folks we talk to, but the voice of leadership is really important. Now, I just said I was going to tell you what's available at the moment, so let's look at that briefly. Right now, there's kind of three basic sets of things, resources about RFWs that are available to HR professionals. There's a Department of Labor toolkit, so that's the Recovery Ready toolkit, if you want to check that out. There are numerous state level and nonprofit toolkits. The New Hampshire Recovery Initiative is a great example of a program that has been not only used in New Hampshire, but picked up by other states. And then we have kind of a lot of decentralized resources. Some of these come from the recovery industry, like from recovery facilities. They might come from religious organizations, they might come from hospitals, and into that decentralized resource bucket, I would also put EAPs. So sometimes SUD treatment support is the responsibility of an EAP, but it's not always easy to tell where the EAP should step in versus what HR should be doing. So I want to draw our attention to something that I think is so vital for us as a group here to think about today, us as a national institute. We have an opportunity to share our experiences as recovery-friendly workplace participants. We have an opportunity to, if we're new to this set of practices, to share our questions. And I think that we can connect to each other through the Recovery Institute. We have all of this information, people saying, we have resources, we need resources, there are some resources out there, but we need to hear real stories. Those real stories come from us. They come from us. And if we want to fulfill the needs that we saw in this survey, the need for proof that this works, the need for individual solutions, the way we can do that is by sharing our experiences. So if we step back to a slightly higher level, looking at all those HR folks we talked to, about 6% of our respondents were recovery friendly. They said their organization was recovery friendly. 12% had plans to become recovery friendly. So altogether, that is 18%. Now, this number may be daunting, only 18%. But this number is also a benchmark. It's going to show us in the coming year, the coming 4 years, the coming decade, how much of an impact our work and our shared stories, our shared knowledge is going to have. As this number goes up, as we share knowledge and experience that people so desperately want, this number is going to go up so that more and more organizations recognize the benefit of recovery-friendly workplaces. When we look at RFWs as a whole, right, when we think about where we're going outside of that 18%, we're looking at ways to improve employee well-being. We've got, as we talked about, better health, better mental well-being, less absenteeism, better workplace culture and morale. We have better business results, higher productivity, better retention, decreased costs. And we also have, on a human level, better support for recovery. We are bringing the issue of recovery out of the shadows, and we are showing people, right, showing our customers, our clients, that recovery is possible, that it is part of the human experience, and that it's integral to the way we work today, right? Supporting people in recovery, that is imperative in the way we work today. And ideally, when these programs are working, we're getting positive feedback from employees in recovery. We're getting positive feedback from our HR professionals saying, we feel ready to do this. And again, we're bringing greater awareness to SUD and recovery. I want to thank you so much for your time. And I know that some folks shared questions in your registration. And so I'd like to turn it back over to Eliza. Eliza, to moderate some questions or to share our next steps.
Thank you so much, Claire. Again, apologies that the video wasn't working. That is because I am the tech person on this team, and that's a little scary, but I think overall we've been executing as best a meeting as we could without videos. This is so important because, as everyone on this call can attest to, the importance of data as we're trying to prove why we need recovery-friendly workplaces, where the gaps are, what HR professionals need in order to even implement this. So thank you to Fors Marsh and HRCI, who is also represented on this call in the audience, who may come off and chime in as needed, but there's many HR professionals that are in attendance, and I know that you'll all have great things to share. I just wanted to direct attention to the first question that was in the chat that, Claire, I believe you should be able to read, but Sam had asked how you asked questions around familiarity with SUD, simply asking respondents to self-report how familiar they feel they are with SUD. She asks because sometimes people overestimate their degree of knowledge. So kind of how that question was asked.
That's a great question. And we did ask people to self-assess. And we're also certainly aware of the fact that, there are some people who are eternal learners, right? And so they may underestimate, as she said, they may overestimate. Given the length of the survey, given all of the things we wanted to be able to ask people, we asked for self-assessments, but we didn't actually test people's knowledge. I do think that when we set up recovery-friendly workplaces, a common starting point is to do an organizational assessment. And there you actually can test people's knowledge. I think that's where that question would come into a more specific application. But I certainly acknowledge, yes, that we did ask people to self-assess.
Okay, thank you.
Can I say, oops, I'm sorry, one more thing. The other thing that we can do, right, is ask people to pre and post test training, right? So we can ask them about their level of familiarity before and after. Do they feel like they've learned new things? So that's another option.
Okay, I see that Dawn asked in the chat, given the Musk announcement that DOL needs to reduce its staff by 90%, how can we use a mix of data and stories and case studies to try to protect RFW? Like Matt alluded to before, we are considering our relationships with the federal government. I know that on my end of things, having history with the governor's office, which was a Republican office during the first Trump administration, we understand how to collaborate on the SUD and RFW end of things. And I'll say that the Institute is really trying to address something that was brought up in this survey, that a lot of resources are decentralized right now, and we're doing our best to bring be the central body. So one thing that we're working on is making sure that all of those documents that may be housed currently by the federal government are downloaded and copy, and so we can embed them on our website, because some of you may have noticed that, for example, the landscape assessment on recovery-friendly workplaces is currently not on the CDC website as it originally was, but that's something that the Institute has downloaded. So we're working on trying to make sure that the resources, as there's lots of document turnover, are still able to be accessed. So that's something that we're trying to do as a private entity, well, a nonprofit, but in no way funded by government. Make sure that all of this information and the stories and the data lives on. So kind of an evolving process. But the next question from Kevin: have any of your orgs tried to frame this as a social responsibility issue? The effect of RFWs can be felt in communities, their local economies, justice systems, etc., for generations. At the Higher Calling Foundation, we encourage employers to think of sponsoring a local RCO no differently than sponsoring a Little League team. Even if they don't support them financially yet, acknowledging their legitimacy is still giving back.
Matt, would you be able to speak to that?
Matt is on mute if he's talking.
Can you hear me now?
There we go. Yes.
Yeah, I think some orgs have framed recovery-friendly workplaces as social responsibility issue. I think it's in a lot of ways Fors Marsh has, but I think it's not always front and center. And I would say the long-term impact on local communities, definitely justice systems, local justice systems, the courts, and but more importantly, families, I think makes a strong case. So I think your point, framing the sponsorship like a Little League team is really a great analogy. I think it's simple, it's familiar, it's community focused. I think it's strong. And I guess my question back to you, have you found certain messaging or like employer incentives that would best work to shift the mindset? We can I posed that question. You can answer it in the chat. We can move on to another question, but I appreciate that perspective, and I think it's the analogy is a good one as we move into kind of a different environment.
I would briefly add to that too, that one of the concerns we heard in the focus groups was some respondents were concerned about what clients might think about an organization that identified as recovery friendly. And so thinking about it as social action is one good way to address that concern, to think of it as like the Little League. Again, that's not possible for everyone, but it is something to consider. So I appreciate that question as well.
And then some are more relevant to the Institute, but trying to keep it within our scope of this presentation. I saw that someone was asking when the full Fors Marsh study will be available and how we can obtain it. I do know that we're planning on sharing this webinar. We wanted to bring this group together as a pre-release to really acknowledge that we want to show you the data that's going on, and I'll let Matt and Claire speak to when it will be publicly available for use.
Sure, I can take that. So the timeline for the report is really going to depend on some internal approvals. The report is done. We're aiming now to release it at some point in April. And like this presentation, we will be conducting some pre-release briefings. But the April release is to maximize exposure, national exposure, media exposure to this topic so that we can continue to drive conversation. Our organization will be attending the RX Summit as will GRI. GRI will have it's contributing to that conference, and so we're hoping to time it at time for the RX Summit, and I think that hopefully we'll kind of maximize our exposure and impact and help raise awareness of the findings of the report.
Great, thank you. I saw that in the Q&A, Ariana Williamson asked, saying, I'd love to see data that shows the impact on RFW on benefit utilization and implementation of drug-free workplace standards. Offering EAP and naming a company as drug-free are very different from effective utilization and implementation. This could drive buy-in to help check the box for leadership, and also integrates recovery-friendly workplace as valuable across workplace operations.
So that is also a great question about utilization. One of the things that we asked people was how they track utilization of their EAP. Let me start with that one. It's very hard for employers to do because especially in small companies, it can be difficult to balance utilization rates and employee privacy, right? If you have a 10-person company and one person uses your EAP for a substance use disorder, it may be easy to identify that person. So that is one concern. On the other hand, we are beginning to find ways to anonymously report what kinds of services are being used, and more companies are starting to do that. We did not ask that question specifically, but I agree that when we can show a decrease in utilization rates, when we can show cost savings on healthcare, those are both important things to do. And the top line answer I have for that is that there is not a ton of research specifically on that question, again, because it can be difficult to gather. Regarding the impact of drug-free workplace policies, depending on the industry you're talking about, you have more or less frequent drug testing. Drug-free workplaces are also changing a little bit, and this is anecdotal, based on discussions I've had with a couple of larger corporations, but some workplaces no longer test for marijuana in doing their drug testing, and they actually advertise that as a reason to come work for them. So at a federal level, having your employees use marijuana is a violation of the federal drug-free workplace policy, but I think employers are trying to rethink that rule. Something like 4 to 7% of employees test positive for drugs. Like, that's what the data overall shows. And that, of course, causes challenges for workplaces. If we wanted to look at this question, right? Many places have been drug-free for years. So it might be hard to get that historical data, but we could think about looking at large level population data. The short answer is that very few people collect utilization data, but I agree that it is important for us in trying to make a financial argument for RFWs.
Just a quick question. Someone asked what percentage you had said.
So I want to double check this with the source, but I believe it's about 4%, which surprised me because it was a little high, but that number came out of a drug-free workplace support site. If you are the person who asked that question, I would love to check my notes and come back to you to make sure I'm telling you the right thing, or I'm happy to share that resource with everyone, because I don't want to get it wrong. I believe that's about what we're looking at.
There's one thing that I wanted to add is that with the Fors Marsh 2022 survey and the release of the federal toolkit and all that we've gathered from state level recovery friendly workplaces, that really informed the National Recovery Friendly Workplace Institute certification. And so we're working on collecting stories from our first cohort of people that have been certified. And one thing that was touched on is EAP utilization. And from all of the information we gathered in the certification, it specifically says in plain language, communicating the EAP and benefits that are available to people, for both employees and their family members covered by their insurance, whatever it may be. But because we know from studies that when people know what their benefits are and the EAPs in plain language, they're more likely to use them. And we have, just from our small first cohort, businesses saying, well, because of this certification, we actually found out that we had an EAP that we were paying for, but weren't advertising, so nobody was using it. And now we're advertising it because of the certification and people are using it. So it's just ways that really communicating being a recovery friendly workplace and having those state programs and the national certification is having those impacts of, well, now they know that they have no cost EAPs, and because they know that now people are accessing it. I did see that someone asked if you're presenting at the National Association of Workforce Boards National Forum in DC.
No current plans to do that, but I've made a note. I'm going to talk to Kathy, and maybe we can get on the agenda there. So thank you for that suggestion.
Another question, do you know of updated industry-specific SUD data that can be shared?
That's a great question as well. One thing that I notice a lot, and you all probably know this too, is that data about substance use tends to lag slightly. So for instance, I just shared that in the chat, that Quest Labs documentation about the 4.6% positivity rate across all of their workforce drug testing. That's from 2021. There are limited publicly available data about positive drug tests across industries. Some industries are more likely to require testing, and I think it's certainly something that we could look into. In terms of the questions that we asked people, we thought that maybe those different industry requirements would lead to different needs or concerns. But in fact, we found that in every sector, people's biggest need was education. They said our biggest problem is misunderstanding and lack of information. So the rates might be different. And that's certainly, information that I believe people are beginning to track now. But the needs HR folks are expressing are the same, regardless of industry. Last thing I'll say about that is that the content of that training would probably need to be customized for individual industries. And that customization could take into account current use levels, and it could also take into account restrictions. I came out of the restaurant industry, and if you've worked in it, you know that there are very high use rates compared to other industries. And then there are some that are quite low. So thank you for that question. People are beginning to collect that data for sure.
Another asked, did you ask employers if they have or know that they have employees in recovery in their workplace? And if so, how many?
We did not ask that question.
Okay.
For a couple of reasons. We did want to think about, needs that people self-identified. And so that's what we were focused on. We also know that people don't always disclose their recovery. And so we were avoiding asking respondents to speculate about people in their organization. One of the things that we heard in focus groups was that there's a lot of gossip let me put that a different way. People were very concerned about gossip, about, are folks gossiping about people in recovery? And so we didn't want to encourage that, in the course of asking survey questions. I would also say that, remember, we talked about those, the sort of organizational assessments, right, that you might do before you start an RFW. I believe that some include that question. But again, because employees don't tend to disclose, it is really asking people to guess. So that's a concern in that question.
Thank you. I'm going to allow Melissa Fleck to talk, as she said she has a perspective on restaurant industry.
Oh, hi, Melissa.
Oh, hi. I wasn't expecting this. Hello. Yeah, no, I'm following along and I'm excited to be here. So thank you so much for putting this together. And I'm here to learn everything about this project that you're working on. And just bring to light, yes, there is a very serious and concentrated conversation that I believe is absent from the work that we all have been doing for quite some time on this issue. And that particularly is, how do we manage the conversation around recovery-friendly workplaces in institutions such as the restaurant industry that not only, has substances in the house, right? And it's part of the, business plan, but the realities of the culture in the restaurant industry for low-wage workers, more specifically sub-tipped wage workers, right? Like we're talking about not only a population of individuals who may be in or seeking recovery, but they are also paid below the minimum wage, right? So we have a socioeconomic perspective here as well that infiltrates a lot of other spaces. And I think this is a really great opportunity for us to take a industry-based approach for this particular industry and really bring home the critical need to influence this sector because there are so many people that don't have access to other jobs or don't have access to any healthcare in these institutions, right? Like we're talking about not only is it a sector that has extraordinarily low wage workers that are predominantly women, right? And then we can get into, further, further lanes of where there is just a lot of, perspectives that are challenging in terms of socioeconomic class and race. But the reality is you're talking about a sector that more than likely does not have human resources, does not have healthcare benefits, does not have any type of human resources department whatsoever. So like these conversations are fantastic when we're talking about the public sector, we're talking about labor, we're talking about unions, we're talking about these institutions that have a framework to address this. But this is a very booming, huge part of our economy that is completely being left out of the conversation. And there is no one advocating for this population in particular because it's very risky to do it, number one. And number two, the National Restaurant Association isn't really interested in the conversation either. So like, how are we actually making an industry impact on one of the most vulnerable populations? And what does that mean for people that are in early recovery trying to keep their job? And I have my own lived experience as a person in sustained recovery that's been in the industry for 30 years while simultaneously working in the recovery sector because I needed two jobs, recovery community organizations are not paying, advocates enough to have a living wage, right? So I've been waitressing on the side my entire recovery. I've got plenty of feedback. But like, then I come back to these spaces and I'm like, we need to do a lot better in this particular area because there's a very vulnerable population here that I think is being overlooked and ignored. So that's what I got. Off the riff. I'm sorry, I wasn't expecting to speak.
Oh, it's fine. I want to say too that I really appreciate that. As I said, I got into work on harm reduction and recovery because of my work in restaurants, and I absolutely agree with what you've identified are challenges in the industry. I think we also see them in hospitality. Like hotels. We see them in some construction, is another place where there are lots of vulnerable people. And in both of those cases too, there's like drinking that is part of your job is what comes to mind. I worked in a restaurant where drinking was a fringe benefit. So there is definitely a real divide between people who are working for organizations that may have the funds, the capacity, the disposition to pursue recovery-friendly workplaces, and organizations that are saying, you know, we're too small, we can't do that. We don't have time. Like, as you said, there is no HR person. But I think it's important to know more about those groups. And I think it's important for recovery-friendly organizations, for people advocating for them, to do some outreach, right? To what our survey finds is that people need these customized resources. And part of that package is to say, hey, restaurant industry person, we're going to support you in doing this. Like, we think this is important. We're going to support you in doing this. My experience with Narcan training in restaurants was that people were very open to it, as long as I showed up with it in my hand and said, hey, can I tell people about this? I understand that's a one-off interaction, but I think it's going to be that kind of outreach that maybe helps us on the ground address the issue while we continue to advocate with, say, the National Restaurant Association for something to happen at a higher level.
Thank you so much, Melissa and Claire, for talking about that. Melissa, I will add that state level programs for recovery-friendly workplace are connected to many restaurants. I saw David in the chat posted a video about Colorado's experience. I can speak to the Institute National strategy of connecting with associations. So I wrote down the Restaurant Association because we do connect with those national associations like Associated Builders and Contractors, for example, because we know the construction industry is deeply impacted, so that if our strategy is connecting to the association and their strategy is to connect to the members, we're just trying to figure out how we can really touch all of these really highly impacted industries and spread recovery friendly. I know that we are at time, and if Claire or Matt have any concluding thoughts, I wanted to say that we will be sharing the recording, like Matt said. Once the full report is available, we'll also be sharing that to this list of attendees. This was a pre-release preview of data that we will be able to use as HR professionals and as people in recovery-friendly workplace programs. So thank you all so much for coming. Any questions that went unanswered, I will take a look at those and follow up. Matt and Claire, any concluding thoughts?
No, I just want to echo thanking everybody who took the time to attend this presentation today, and to thank you all for your work. We're all in this together.
And yeah, I would say the same. This project has been, you know, at a personal level, addressing kind of a really big and seemingly impossible dream for me to make the world better for especially folks in restaurants who are near and dear to my heart, but for everyone. So I'm so glad that we can share this information with folks who are out there on the front lines, making recovery-friendly workplaces work, and thinking about, yeah, moving us all forward and ways that we can share our experiences, our problems, and use them to continue to amplify the movement. So thank you so much for giving us your time and attention.
Thank you, everyone. Thank you, Fors Marsh and HRCI, for making this happen. Look forward to continuing this partnership. So thank you all.